Hello, everyone. I'm Robert Falcione, the editor of HawkNews.com. We're having this special edition of Live on Main tonight, Thursday, so that we can accommodate everybody's schedule. And with us this evening to discuss men's health and the prostate in particular is Dr. Jeffrey Steinberg.
Robert, thanks for having me.
Oh, I'm so
Appreciate
happy
it.
you could come because this is such an important thing for men to know about.
It is.
Should we talk about what is the prostate?
Sure, that'd be a good start.
Eric
way to
has a
start.
camera on your model.
Yeah. So the prostate is a walnut-sized gland at the base of the bladder through which the urine travels and out through the urethra. And it's a reproductive organ. So early on, when men are young, it makes fluid that goes into the ejaculate to preserve the sperm. Later on, as a man gets older, it really just causes problems, either benign growth, making it harder to urinate, or can turn cancerous later in age. So it's important to know about prostate health, especially if you have a history of prostate cancer in your family. You should probably go in for a checkup, definitely starting at age 50. But if you have a first-degree relative like your father or brother who's had prostate cancer, you should think about getting tested started at age 40. And a test of the prostate includes both a PSA, which is a blood test called prostate-specific antigen. It's a simple blood test taken from the arm. It can be done in your doctor's office, as well as a digital rectal exam, and that's where the doctor will do a prostate exam and feel the outside surface of the prostate to make sure there's no nodularity or any irregularities there. And those two tests really are the appropriate screening tests if you're at risk for prostate cancer.
Okay, now, as a person's age increases, does the risk increase?
Yes.
Even without a family history?
Definitely. As you get older, your likelihood of having prostate cancer increases. And what's been controversial about prostate cancer is when do we stop screening? If a man is in his late 70s or 80s, oftentimes he can have other medical problems, and prostate cancer may be the least of his problems. So recently there's been a lot of discussion between the professional medical societies about when to stop looking for prostate cancer. And pretty much there's agreement that after 75, PSA testing is optional. Of course, not every man who's 75 has multiple problems, and if they wish to be screened for prostate cancer, they can continue to be tested after that age. PSA is an imperfect blood test. Unfortunately, the level can be high if a man has an enlarged prostate without cancer or has infection or inflammation. So there's other tests if the PSA test is high that your doctor will advise, and ultimately, if it's indicated, may ask a urologist to perform a biopsy of the prostate to determine if there is in fact cancer in the prostate.
Now, under what conditions should that 40-year-old insist on being checked? Because if he has difficulty urinating?
Well, 40-year-olds who have a family history for sure should talk with their doctor about getting tested with a PSA and a prostate exam. But men who have difficulty urinating, getting up at night, a weak stream, feeling like they're not emptying their bladder all the way, should definitely talk to their doctors about getting tested. Most of those symptoms are from benign growth of the prostate. Doesn't necessarily mean you have cancer. The thing about prostate cancer, it really is a disease that early on has no symptoms, because when it occurs, it'll occur in the outside of the prostate, in this area, and that's where we can feel on digital rectal exam. Until it impacts this urethral area and closes off the urethra, you really may not have much in the way of urinary symptoms. So it's really the later stages of prostate cancer. We start to get perhaps pain when you urinate, blood upon urination, and real major difficulties.
Now, when you say an enlarged prostate, if it weren't cancer and were not a benign growth, then what would be the cause?
Benign prostate enlargement occurs in every man with age to some degree or other. So what would happen with a benign enlargement of the prostate is that, if you can see this, this is a normal channel between the bladder and the urethra. And then over here, as the prostate grows, it not only grows outwards, but it squeezes inwards to make it more difficult to urinate, so you're trying to empty through a narrower channel. And the typical symptoms of that are getting up at night, frequent urination during the day, straining to urinate, and feeling like you have to go back and urinate 5 or 10 minutes after you just went to the bathroom.
Now, do some people with those symptoms, is it as a result, or is it in the indication of infection? Or
It can be. So if the things that come on fairly suddenly are more consistent with infection, you can see blood in the urine, burning when you urinate, etc. And then a simple urine test can indicate whether you have an infection, and that will typically go away with antibiotics. But if you get symptoms that are gradually progressing and a urinalysis doesn't show an infection, that's when you really ought to do further testing, including a PSA, prostate exam, and possibly even what we call a cystoscopy, in men to look inside the bladder to see if there's other problems such as polyps in the bladder, which can then turn into bladder cancer, stones in the bladder, other abnormalities within the bladder.
Wow.
So if it goes beyond a simple stage, simple diagnosis, then your primary care doctor will often refer you to a specialist, a urologist, to further investigate.
And
what's
you are a
going on.
urologist?
I am. I'm a urologist.
And is it a uro? Excuse me.
That's okay.
Is it a urology surgeon?
Yes.
Is that the correct
So
name
all
for it?
urologists are surgeons. We're trained as surgeons, and we not only do testing in the office, but we do operate procedures on the prostate, the kidney, the bladder. Testicular cancer is a big area. And then we also do things like managing erectile dysfunction in men, incontinence or leakage of urine, kidney stones, and then cancers that occur both in the prostate but also in the kidney, bladder, testicles, adrenal glands, etc. So we are trained as surgeons, and we do treat all abnormalities of the genitourinary tract.
Now, regarding testicular cancer, and I never remember this, but I lost, on my father's side, a cousin at 12 years old.
Wow, yeah,
With,
that can be.
That's,
So
I
testicular
understand.
cancer is,
Yeah.
it's not as common as prostate cancer, but and it's a disease of younger men, typically ages 18 to 35. And the first sign of testicular cancer would be a lump in the testicle, not typically painful. And that's why we encourage young men starting as adolescents, when you become a teenager, start doing testicular self-exams, at least once a month. Make sure that the testicles are nice and soft, they don't feel any lumps or bumps. And then obviously if they do, they need to go to their primary care doctor. But testicular cancer is a disease of younger men. Prostate cancer is a disease of older men.
I want to call him a general practitioner, but it's called
A primary care physician, either an
Primary
internist
care.
or family practice.
Now,
Yeah.
are they generally, as a rule, going to show a 12-year-old how to do that? How
Well,
to self-examine?
Yeah, I mean, that is one of the roles of primary care docs, and obviously they're very busy these days in terms they have to cover all the bases, so to speak, on an annual exam.
Right.
So it can be difficult, but there's a lot of programs through schools and other community organizations that actually will inform young men and their parents how to do testicular self-exams. But it's important to start when you're around 12 or 13
Right,
to make
yeah.
sure there are no lumps or bumps. And what I tell kids who come into my office is the first day of the month, every month, after you take a shower, just feel down there for a minute. Make sure everything feels the way it did last month. And if something feels funny, hard, or abnormal, tell your parents, and they'll take you to the doctor to have it checked out.
Well, that's a good idea, because after little Johnny died at 12, and that was probably in the mid-50s, his mother was on a crusade, so to speak, to make sure that young men knew enough
About
to do a self-exam,
Yeah.
because she feels he would have been saved.
Yeah, the good news is if you catch testicular cancer early, it's completely curable. And it's one of the triumphs, even in the late stages now, the cure rate is very high with chemotherapy, radiation for some types of testicular cancer, and surgery. So the cure rates are much, much better than they were back when your cousin was diagnosed. But the key is finding it early on before it spreads.
And now, with prostate cancer, I read a handout that said that I believe I had to subtract or add something, but the 97% of the people who are diagnosed with prostate cancer do not die from prostate cancer.
That's true. A lot of men more men will die with prostate cancer than of prostate cancer. And that's where some of this controversy came in, is when do you stop looking for it? What we're looking for is aggressive cancers in younger men that's going to shorten their duration and quality of life. So even after we do a biopsy, in order to determine how aggressive the prostate cancer would be, we have to actually look at the tumor under the microscope and see what the grade is. And if it's a high-grade tumor, of course, we're very aggressive about treating. We're doing more what we call active surveillance these days, where we're finding small amounts of non-aggressive cancer in older men and not treating it. We're watching it with PSA and other tests, and we're finding that can be a successful approach without doing surgery or radiation, to just follow man. As long as the PSA stays stable and their symptoms are minimal, we can continue to watch that man and they won't suffer any consequences. But again, only for small early tumors which are low grade under the microscope.
And that's called the wait and see approach.
That's wait and see. We like to come at it as a more active.
Mm-hmm.
So we call it active surveillance rather than a passive wait and see. We're doing something about it by monitoring, but it's pretty intensive. We have to do a PSA and prostate exam every 3 months, and then oftentimes I'll recommend to my men who are on active surveillance, we do a repeat biopsy once a year.
Wow. Yeah. And what is the most, I would say, common practice that you would engage in? Is it surgery? Is it radiation, a combination of both?
Well, for prostate cancer specifically,
yeah.
Well, again, in young men, when we catch it early, surgery, complete removal of the prostate is kind of the standard of care. So we take out the prostate gland and these other two glands called the seminal vesicles, then we have to reconnect the urethra to the bladder. In older men with aggressive tumors who might not do well with surgery, we'd recommend radiation to the prostate. And that can be given over 8 or 9 weeks, a small amount of radiation every day. It's painless. You go to the radiation center, you lie on the table for 15 minutes. It's painless. You get up, walk away, go about your business. And sometimes with the radiation, we'll recommend that the man has hormone treatments or shots to actually shrink the prostate and make it easier to treat during radiation.
And how about testicular? Is it surgery in all
Testicular
cases?
cancer, usually it involves removal of the testicle to see what the tumor is made of. And then some types, one called seminoma, a patient may receive radiation to the lymph node areas above the bladder where the testicular cancer would be most likely to spread to. Sometimes chemotherapy if it's found in other places. So it really depends on what the primary tumor is made of and whether it has spread beyond the testicle, in terms of whether a patient can just have surgery and you're done with it, or whether you may need radiation or rarely chemotherapy as well.
When I speak with people, it's amazing how many people have had or have prostate cancer.
Yeah,
But these other cancers aren't as common.
Not as common, yeah. Probably less than 50,000 cases a year in the United States of testicular cancers. Prostate cancer is 185,000 new cases every year, still close to 40,000 deaths, although the death rates are coming down in prostate cancer because we're catching them earlier. So in kidney cancer, again, much less than prostate cancer. Bladder cancer can be another very aggressive disease, so if you ever see blood in your urine, you should tell your doctor right away, and you may require cystoscopy, because just like a colonoscopy, which men should have after the age of 50, if you see blood in the urine, you require a look in the bladder, which can just be done in the doctor's office. And if you catch early polyps or low-grade tumors, we want to get those out, scrape those out before they turn into invasive cancers into the wall of the bladder, because that requires major surgery once it's gone into the muscular wall of the bladder.
And people should know, I read this somewhere that I felt was a pretty good source, is that smoking can cause bladder cancer.
That's true.
Who would know?
Smoking is the #1 cause of bladder cancer, but a lot of people who we find bladder cancer in, they say, well, I never smoked. Well, it also can be, it has some hereditary factors, but also there's a lot of secondhand smoke. If you grew up in the 50s, 60s, and even early 70s, everybody was smoking. So that smoke was passive. You did inhale that if you were near other smokers. But many people have develop bladder cancer with no risk factors at all. So, again, any sign of blood in the urine should be investigated. Blood in the urine is very nonspecific. It could be from an infection, could be from benign enlargement of the prostate, but you really have to rule out any kind of tumor in the urinary tract. So anybody comes in with blood in the urine, my typical approach is do some special urine tests called cytologies, where we look for malignant cells in the urine, look in the bladder, what's called a cystoscopy. Again, that's done in the office. It really takes literally 1 minute to do under local anesthesia. And then some type of x-ray or ultrasound of the kidneys to make sure that there's nothing in the kidneys that could be bleeding.
Very good. So this might be a good time to let people know where to find you. Do we have a graphic on that, or should we just say it? Okay. Well, Dr. Jeffrey Steinberg. His phone number is 508 473.
Right. 6333.
That's right.
And I'm
That's
located in Hopedale. The name of the practice is Urology Specialists of Milford at 54 Hopedale Street in Hopedale. And that's right next to Town Hall in the Hopedale Professional Building.
And is there anything that you didn't cover, do you think?
Well, I think it's just important that anything that seems abnormal, and if you feel a lump in your testicles, if you're having changes in urination or changes in your bowel movement that you can't really explain, I think it's important to bring that to your primary care doctor's attention. Because the goal here in all cancer detection, just like women go for mammograms every year, you want to find these cancers early when they're the most curable. So we don't do routine cystoscopies on patients every year. That's too much. That's way too much. But if you find some change in the urination, blood in the urine, burning, increased difficulty, or you feel a lump in the genital region, tell your primary care doctor, and he or she will likely refer you to a urologist for further evaluation. The key is early detection.
That number again, 508-435-6333. We never did mention Harvard Medical School, did we?
Yeah, so I did train. Yeah, I trained in the Harvard program in urology. I've been practicing for 25 years now, and I treat men and women of all ages. And my primary hospital is Milford Regional Medical Center. That's where I do my surgery.
Thank you very much,
Robert. It's a pleasure.
This is
I hope this was
awesome.
helpful to your viewers.
I hope that you're in the business of saving lives. I hope that this 15 minutes or so is going to lead up to saving lives.
Well, I think if we could change one person's life through this podcast, I'd be delighted. So thanks for having me.
And thank you for being here, and thank you for watching.